Federal government queries World Bank survey indicting Nigeria of supplying less than 12 hours of electricity to consumers. Plus, lending hands to the national efforts to end malaria in Nigeria, a non-governmental organization takes malaria intervention services to community. Well, we'll bring you the details shortly on Panorama. Thank you for joining us. I'm Ruth Aguela. The federal government has questioned the report of a survey conducted by the World Bank, which claimed that 78% of electricity consumers in Nigeria get less than 12 hours of daily supply. A statement by the Special Advisor to the President on Infrastructure, Ahmed Rafai Zakari, says it is unclear what empirical evidence the World Bank used to arrive at the figures, insisting that power distribution to consumers in the country is steadily improving. Federal government says empirical evidence from the Nigerian Electricity Regulatory Commission shows that only 55% of electricity consumers connected to the grid are in tariff bands D and E, who have less than 12 hours supply. On the prepaid meters, where World Bank reports claim that 58% of electricity consumers in the country do not have meters to measure electricity use, federal government disagrees with the report, insisting that data obtained by the bank are unverifiable. With the robust working relationship it enjoys with the bank, especially in the implementation of power sector recovery program, federal government wonders why such a report is released without input of other key players in the sector. Minister of State, Labour and Employment Festus Keyamo says the federal government's Special Public Works Scheme, intended to provide modest stipends to skilled, semi-skilled and unskilled Nigerians, is yielding the desired results. Achibong Basi reports that the minister, while assessing the impact of the scheme in Calabar, applauds President Muhammadu Buhari's administration for the initiative, which also aims to achieving a cleaner and hygienic Nigeria.
The Special Public Works Scheme is one of the 4 core programs of the National Directorate of Employment, designed to explore employment opportunities that abound in the public sector by engaging 1,000 skilled, semi-skilled, and unskilled persons in each of the 777 local government areas in Nigeria. Participants in the short-term engagement of a scheme which spans for a period of 3 months are to be paid a monthly allowance of 20,000 naira.
All of you will be paid, every kobo you will be paid, so be rest assured. I'm sure you know payments have started. Yes. And you know I issued a public statement as to why the payment was delayed. Yes, the banks delayed it because there were too many discrepancies, and we didn't want fraud.
This beneficiary, Inakepe Solomon from Obanliku local government area of Cross River State, shares his testimony about the scheme.
Thank you to His Excellency President Muhammadu Buhari. The beneficiary of Calabar Municipal are very grateful. I mean, this is a relief. Though it's little to what they are giving, but it means a whole lot to my family.
The minister and his team are also expected to monitor the compliance level of the scheme in other parts of the country. In Calabar, Achibong Basi, NTA News.
Well, Nigerians must shun political party differences and rise up to the task of solving the nation's security challenges collectively. Now, this was the position of the Inter-Party Advisory Council at a peace conference tagged Let's Talk Politics. Timothy Yusuf reports.
Every political leader should be held accountable for inactions or actions that is either directly perpetrated by him or his troop or his followers.
This gathering of like minds is premised on one agenda: politics without violence. Participants believe that there is no alternative to peace and reminded the political class that the task of ensuring a peaceful Nigeria is a collective responsibility.
Ensure that everybody says that which is right and verifiable.
Everything must be done to de-emphasize violence. Again, this will not produce good leadership in the land.
Embrace the opportunities available in the political space of this country to be able to stand up and have a voice.
While urging the youth to remain as agents of change, considering their posture as future leaders, they must realize that politics is for development and not for perpetuating violence.
And what I can say to younger population, don't give up. You have to try in a more strident manner to keep trying.
It's for us to be encouraged to get involved so that not only in making good policies, but also to make sure that those policies are implemented.
The conference maintains that dialogue remains the best option for conflict resolution. In Abuja, Timothy Yusuf, NTA News.
Let's look at health. This year's World Malaria Day calls for collective actions against the scourge. Lending hands to the national efforts to end malaria in Nigeria is a non-governmental organization, Nation First Foundation, who took malaria intervention services to Jabi community here in Abuja. Ekene Ndule reports.
Stand up, take action is the slogan for this year's World Malaria Day in Nigeria. To contribute to the action against the disease, Nation First Foundation was at Jabi community to provide insecticide-treated mosquito nets, malaria tests, and drugs at no cost to the residents.
It is possible in Nigeria. That is why we are partnering with the Ministry of Health through the National Malaria Elimination Program to see how we can fight together to eliminate malaria out of Nigeria.
To achieve malaria elimination, each and every one of us in Nigeria must stand up and take action. In the area of adhering to malaria intervention, the aspect of prevention.
After some health talks, residents felt better poised to fight the disease.
Right now here, they have taught us a lot about malaria.
I learned how to take care of malaria by using nets.
Malaria accounts for more than 60% of hospital visits in Nigeria, 20% of under 5 mortality, and 11% of maternal mortality.
The good news is that malaria is preventable and treatable. That is a major takeaway for this set of beneficiaries after a pep talk from the health practitioners. How far are they going to implement what they learned here today? That remains to be seen. In Abuja, Ekene Ndulwe, NTA News.
All right, and a look at another aspect of health, which is very important, immunization, which has been acknowledged as one of the world's most successful health interventions, which has saved millions of lives yearly. Now, the low rate of vaccine coverage is worrisome to relevant authorities. Uche Ugochukwu in this report draws attention to the importance of not relegating other vaccines to the background as global efforts are directed to the COVID-19 vaccine.
Health Organization estimates that 2 to 3 million deaths are prevented annually through immunization. However, Nigeria is said to account for 30% of global unimmunized children aged 0 to 5 years, despite concerted efforts by stakeholders to reverse the trend. The coronavirus pandemic makes the situation more precarious, and the Health Organization is worried about a decline in successes achieved in the past years.
The WHO UNICEF estimate points to the fact that Nigeria, with all those investments, have been able to reduce the number of children unimmunized from 4.1 million to about 3.1 million just between 2017 to 2019, and this is really a significant feat. That notwithstanding, the 3.1 million is quite very high because it's the leading number in terms of unimmunized children globally.
The end of March, April, there was a dip in routine immunization. From May, between ending of April, early May, there was training for those categories of people, I said the health workers and the community members. We could see routine immunization at the end of May begin to peak. We had a meeting with the CDC online, and one of their leaders in the US used the opportunity to say Nigeria should document what they did because they were following the trend of what the country was doing to set examples to other African nations.
People's attitude to vaccine in the face of COVID-19 is another issue of concern. Ibrahim and Iyabo are among the many not willing to take vaccines.
No go take. Nothing concern me with that one.
I know they carry my children go there immunization because I don't like them.
The task before relevant bodies as highlighted in the 2021 World Immunization Week with the theme, Vaccines Bring Us Closer, is to build vaccine trust, raise and maintain vaccine acceptance among persons like Ibrahim and Iyabo. With efforts to increase confidence in vaccine, there is hope that the nearly 20 million unimmunized children would be reached. Uche Ugochukwu, NTA News.
All right, let's expand the discourse, and we have a guest joined us to speak further on World Immunization Week for this year. And the theme for 2021 is Vaccines Bring Us Closer. Let's welcome Mr. Peter Hawkins. He's UNICEF country representative in Nigeria. Thank you for joining us.
Good afternoon. Thank you for inviting me.
Good afternoon to you. Now, I'm very sure you're aware that the COVID-19 vaccination has posed a major obstacle to, the regular routine immunization. People no longer observe that. But from your assessment, would you say it's still consistent?
It is. I mean, Nigeria is a very good example, as your report has said, as how it's built up over time to ensure that children are vaccinated, especially during the pandemic. 2017, 2018 and 2019, routine immunization year on year increased significantly. 2020 was a challenging year, but it only reduced by about 6 to 8%. The problem, as Dr. Bassi and Dr. Kofi have outlined in your report, are the children who are not vaccinated, what we call zero vaccinated children, the 3.1 million children. So in 2021, not only is there a strategy to ensure that we continue to vaccinate children with routine immunization, that's every day over the period of the year, but also to target those 3.10 vaccinated children so that we can reduce that significantly.
Now, in view of what is already happening from what you're saying, what is the risk, especially for these children who will miss out on life-saving vaccines, like measles, polio, and the rest of them?
Well, the task is bringing routine immunization brings us closer. Yes. It also saves lives. I mean, that is the most important thing. About 800,000 children die a year, under 5 in Nigeria. And we have to reduce that significantly. And one of the best ways and the most effective ways through routine immunization is ensuring that all children are immunized. Secondly, as Nigeria celebrated very successfully the zero wild polio in 2020. That was a significant step that we're moving forward. We are addressing the pandemic as well. And with COVID-19 vaccination coming in, as Dr. Bassi quite rightly said, we need to find the right balance between the training and the application of COVID-19 vaccine and maintaining routine immunization. One of the key elements to that, and I would plead here to all health workers, is the health workers should take the COVID-19 vaccine so that they can continue with a healthy future to routine immunization and not get affected by COVID. If they are vaccinated, they are safe, they are able to continue routine immunization and ensure that the primary healthcare system and structures continue unabated.
And before we jump on the efficacy of the vaccine, let's look at how poorer countries are coping, with the surveillance we've seen so far. Accessibility is a major challenge. What are your thoughts?
No, surveillance in Nigeria is actually very strong because Nigeria has so many different diseases, malaria, Lassa fever, polio, and a lot of the surveillance was built up by WHO and MPCDHA to ensure that polio and other diseases are brought in early. With COVID-19, we were exceptionally challenged by the testing. The testing has been overcome. All 36 states have an element and a capacity to test against COVID-19.
What about accessibility for poorer countries, this COVID-19 vaccines?
That is still a dilemma. And then it's a dilemma, the whole issue of supply and demand is a big issue around COVID-19 vaccines. But Nigeria has been lucky that it has received 3.924 million doses second highest amongst the 92 middle income and low income countries under the COVAX. The COVAX system evolved by Gavi, WHO, CEPI and UNICEF. So that 3.924 million doses, over 1.44 million people have received their single dose. And that is a success given we're only, 2 months into the campaign. Then the challenge is going to be, one, to ensure that all health workers get vaccinated. And again, I plead to all health workers, go and get vaccinated now, quickly, and to ensure that you are healthy going forward. The second challenge is to make sure that people do take their second vaccine. There's enough vaccine for the second round of the vaccine, which will start sometime later this month, sometime later in May, and then it will be able to finish that. And then the third is obviously what you're alluding to, is making sure more vaccine comes in so that we can continue right through 2021 and into 2022 to make sure that 51.4% of the population are fully vaccinated against COVID.
Okay, now you're just talking about the second dose coming in May, and there's still the question of trust. So the first dose, people are, before we started this conversation, you were asking me if I've taken my jab, you know, and a lot of people out there still have this trust issue of if we saw that in the report earlier, if they're ready or willing to go take this vaccine. What would you recommend, you know, as part of strategies they can deploy to help people?
I strongly recommend that people do take the vaccine. It's the risk against the vaccine far outweighs the risk of not taking the vaccine. I've taken the vaccine and I will continue to take my second dose. My mother-in-law, all my family, and all my colleagues that are around me, I encourage them to take the vaccine. Many people are taking the vaccine. The risk is 1 in a million, even less. It's far more likely that you get hit by lightning than you would be affected by the vaccine. It's 1 in 500,000 will be hit by lightning, 1 in a million that you'll be affected negatively by this vaccine with thrombosis. We have had no cases of thrombosis in Nigeria, and we're trying to improve the surveillance to ensure that we do capture all the negative effects of the vaccine. So please take the vaccine. It's important that Nigeria is protected. There are things being put in place, so there are enough vaccine for Nigeria to vaccinate 51.4% of the population, or 112 million people, which is an enormous number of people. The health workers are key. Not only do they demonstrate to the rest of the population that that it is safe, but it means they can get on, and especially in this week of Immunization Week, they can get on and continue the life-saving routine immunization for children as well.
Which is very key. And if I heard you correctly, you said the second dose of the COVID-19 vaccine will be in May. Now, for people who have taken the first jab, what happens if you don't take the second one?
The impact of, or the effect of the vaccine will deteriorate over time. Taking the second one may make sure that the efficacy goes to over 90%. So take that second one. It's so important that you do first and second. There are enough vaccines in the country that if you have taken your first one, you can take your second one. So make sure you look on the card when the date is to take your second one, and make sure you take that second one.
Okay, so for people who did not pay attention to the dates, you know, of taking theirs, that's the first jab, is there an issue of delay? Because some persons are, you know, thinking that they are being delayed for the second dose.
There's no delay.
Okay.
Because 50% of the vaccine have been held, doses have been held behind to ensure that people can take the second dose. It is well managed in Nigeria.
Okay, what about supply and availability? What is UNICEF doing in that right, you know, to assist countries like Nigeria?
So UNICEF does a lot of the procurement for COVAX, for the AU and other bodies. So we're day and night trying to negotiate with different manufacturers for different vaccines to ensure that we get enough. The problem now is that there are enough vaccines being produced, but for example, and we've all seen the problems in India. India now are using a lot of the vaccines to ensure that its own population are vaccinated. Immediately the export permits will come and vaccine will be able to come back to Nigeria. But it's very clear to say that the 3.94 million doses that Nigeria has received, if you've had your first dose, make sure you have your second dose. There is enough vaccine here. It's about the next load of people, especially the over 50s, those that are compromised, that it's important that we get enough vaccine. And the next one will be about 2 million doses, the one after about 2.9 million doses. They will arrive as soon as the market allows us to bring it in, and that should be sometime soon over the next quarter.
Thank you very much, Mr. Peter Hawkins. Thank you for your time with us.
Thank you very much.
And keep up the good work.
Thank you.
Okay, he's the UNICEF country representative in Nigeria. And like he said, please go get vaccinated. It's very, very important. Let's go on a break as you ponder on that.
We need to reach out to the people. We should convince them. We should use the systems that we have used before in getting our people vaccinated over the years.
Please, this is good for you and good for others and good for the health of all Nigerians.
I want to reassure our people that as your governor, I will not subscribe to anything that will harm you nor affect your well-being.
Which has helped other states, including our states, to demonstrate capacity to rise to the occasion in our collective effort to win the desired war against COVID-19.
From all indicators, quality, safety, efficacy, the benefits outweigh the side effects. So, from all indications, the generally safe.
I have to congratulate Mr. President and particularly the PTF, headed by the Secretary of Government.
It's 24 hours, bringing the country's total confirmed cases to 164,719. The Nigerian Center for Disease Control indicates that among the new cases, Lagos has 18, Rivers 7, Oyo 6, FCT 2, while Ekiti and Kaduna states recorded a case each. Active cases nationwide are 7,732, while those discharged so far stands at 154,926. That toll is now 2,062. In furtherance of its commitment to reduce the negative impact of COVID-19 pandemic on individuals and businesses across the metropolis, Lagos State Government has launched Coronavirus Action Recovery and Economic Stimulus Initiative tagged Lagos Cares. Governor Babajide Sanwo-Olu unveiled the program at an event attended by stakeholders in various sectors in Lagos. Let's hear more from Musa Toliat.
The launch of the COVID-19 stimulus program is not unconnected with the need for a sustainable social security initiative that will offer lifeline to vulnerable Lagos residents and bailouts for the business community in the state. The program, an offshoot of the Nigeria COVID-19 Action, Recovery and Economic Stimulus, is targeted at supporting more than 2,000 MSMEs, 20,843 households, while 125,058 residents would indirectly benefit from the program.
The Lagos State CARES program will be implemented between the years 2021 to the year 2023. I urge all Lagosians to therefore key into the deliverables and the benefit that the Lagos Care Initiative and to cooperate with the independent verification agents that will be deployed in all of our neighborhoods to ensure the success of this strategic program.
Governor Babajide Sanwo-Olu, while inaugurating a steering committee for Lagos Cares Initiative comprising cabinet members who will oversee the implementation of the program, also launched the Lagos State Human Capital Development Core Working Group with a mandate to ensure effective coordination and implementation of human capital development intervention in the state. The group is to be headed by the Deputy Governor, Obafemi Hamzat. In Lagos, Musa Toliat, NTA News.
And that's Panorama for today. Thank you very much for your time with us. But let's remind you that we can stand together against rape and rapists. I'm Ruth Aguela. Bye.